Kidogo?
Don't smoke on me.
So in the last 2 years, how would you describe your health? Has it improved?
Good morning. We are at Nangina. Okay, I have to ask the producer there to get the pronunciation correct. We are in Nangina, in Samea sub-county, in rural Busia. We are visiting 2 places today, and from here we're going to the sub-county that encloses Lake Victoria. So we're doing a half day here and a half day there tomorrow, and the community health workers and the nurses will continue the work for today. The whole essence of that is to be able to train people, and the nurses and the palliative nurses, to be able to do the work themselves. So this is quite important that what we are doing now, since Monday, is continuous. It doesn't just end when we leave. So we are very pleased and very, very pleased to see the improvement from last year to this year. As you can see behind me, there are the community workers who are attached to each of the group. So they are more or less conducting the interviews, they're more or less going through the survey, the data, and within the rooms, if you just point the camera to the rooms, you can see in there you also got the palliative nurses who are now trained to do this work. So the beauty of what we are all doing together is the county has embraced this program. The county has really worked hard to ensure that up to the grassroots, down to the grassroots level, everyone has fully been involved on the process the way through. So I think in retrospect, this is worthwhile work. At the end of the day, we have done a great thing together through our partnership, through our relationship, through understanding and patience. You know, it doesn't happen overnight. We still have a lot of work to do. But the first stage, let's raise awareness, let's get people trained to be able to do this work. And then we can go to the next level. Everything starts with one step. I know if we continue like this, 5, 6, 7 years from now, a lot of lives will be saved. We know how many people we have seen and referred to the hospital with cancer. I mean, it is shocking for the people, for the government here. It is shocking for us too. But we know there are more people out there that were not informed about this project, that are not aware of this project. And we are going to work hard to ensure before we come next year, 12 months from now, the government will do as much as they can to reach more people and to get more people to come out and get these free services. It is free to have all this screening done in this county, and they're doing a great job. I must appreciate them for that, and I must appreciate the volunteers from traveling from Scotland, from England, from Nigeria, from different places to come and support Cancer Africa and also the Busia Health Government. Next year, we know that we have a lot of volunteers coming from different parts of the world. We welcome you. It is safe to be here. We've been here now for 10 days and we've had no problems. There's been no riots, there's been no kidnapping, there's been no terrorists, nothing. It's very safe. We move around at night and morning and day and time. We've had not a single problem. You know, every country has its issues, but here, so far I haven't seen any. So I want to encourage you, use us as an example to know that it is safe to be in Busia. I'll do a short interview with the Minister of Health later, so he can reassure you that if you want to volunteer to come and help this program, think about the lives that we can save. Think about the people that we can impact their lives. I hope after watching this video, we convince you that let's come together, let's work together. And I thank all my colleagues. Thank you very much. I'll speak to you later when we get to the next site.
Sure.
A picture taken, yeah?
You can hold the baby.
Tell her she can sit next to you if she wants.
No.